I'm Megan Andriano, and I'm the manager of Integrative Therapies at JourneyCare. Our team includes art therapy, music therapy, massage therapy, and music thanatology. Our services are free of charge to any pediatric patient or adult hospice patient that needs additional intervention from the core team for clinical symptoms such as pain, discomfort, anxiety, or emotional distress. Our core team is the first to provide either music, touch, or art to our patients and families. For example, if music is important to the patient, the care team may sing while providing bathing, or a chaplain may be singing during prayer. If touch is important to the patient, a CNA might provide a foot massage after providing personal care. And if art is important to the patient, a social worker may color alongside with the patient and family member to promote relaxation and socialization. If pain, anxiety, or emotional distress need to be addressed in depth in addition to the core team, our team can be called in to assess and decide which discipline might be more fitting to address clinical symptoms, determine a course of treatment, and within that course of treatment, also educate the patient, caregiver, and family on how to utilize music, touch, or art for continued symptom relief. With art therapy, a patient doesn't need to identify as an artist, nor do they need to be physically able to make art. Art therapy can create a safe space of empowerment to promote relaxation, gained insight, expression, and also refocusing the mind away from pain. In an art therapy session, a patient may be focusing solely on the process of art making for symptom relief, or a session may include working towards a finished product, a legacy piece to leave for their loved ones. In either approach, the patient may be making the art, or they may be guiding the art therapist in creating the piece. Our music therapists facilitate supportive musical interventions to increase empowerment and address depression, anxiety, emotional distress, promoting movement and refocusing the mind away from pain. Sessions can include active or passive music making. This can bring the family together for emotional processing, facilitating lyric analysis to increase coping skills, or also working towards a legacy project to work with anticipatory grief. Our licensed massage therapists work to address anxiety, emotional distress, and other physical symptoms that can be caused by contractions, stiffness, shortness of breath, muscular skeletal tension, cramping, or muscle spasms. They can provide these sessions in a variety of settings, including if a patient is in bed or sitting in a wheelchair. They provide personalized care, paying attention to pressure and technique in order to provide that symptom relief. Our certified music thanatologists use prescriptive music from their harp and their voices to address acute pain and symptom management that can occur near or at end of life. Our music thanatologists can be called for urgent patient matters and usually can respond within 48 hours. This can address, again, acute symptoms or if the patient is actively dying. Music thanatologists can address respiratory distress, delirium, restlessness, and also provide additional education to the family about the dying process. I'd like to share a mission story with you now about an adult woman who was on our hospice services. She was bedbound and referred to our team for anxiety management. She started with a course of treatment of music therapy, using music in the moment to address her anxiety while also working towards a legacy project, a playlist for each one of her family members. When that piece was completed, they decided that she wanted to work on album art, so then she was referred for a course of treatment of art therapy. During those sessions, she designed the album art and came up with dedications for each family member. She died peacefully in her home, and every family member got a personalized album. Thank you for listening today. Through music, touch, and art, we at JourneyCare are able to work with the mind, body, and spirit of our patients and families.